once people are doing what they can kind of day to day, Vidya, what fertility tests are available for someone with endometriosis, even if they're not trying to conceive yet, but they might just want to know kind of where they're at with fertility?
The fertility investigations would include a blood test, which checks for anti-Mullerian hormone level. It's a hormone secreted by little cells that line the water bubble that contain our eggs. It gives us a rough indication as to what our egg reserve is at this point in time compared to a lady of our age. But quite often, it does not predict your future fertility. It gives a good idea of your egg reserve at the moment. So, therefore, if you're an individual wanting to exercise your reproductive choice, or even have underlying endometriosis and thinking of fertility preservation, then doing that test may be valuable, because then you can ascertain if you want to do a IVF cycle for egg freezing before any endometriosis treatment. It is not dependent on your cycle, so it can be done at any point in your menstrual cycle. The second test is a scan. And you mentioned something very important there is individuals with endometriosis. A scan will be very important, especially a transvaginal scan or an internal scan, because with endometriosis comes scarring due to adhesions because of the inflammatory deposits of endometriosis in the pelvis. And what happens is the anatomy of the organs in the pelvis is a bit distorted. So doing a transvaginal scan to ascertain the position of the ovaries, as well as ascertaining the number of follicles. As I alluded to earlier, follicles are the dark little bubbles that contain the eggs. And it's representative of the number of eggs we're getting recruited on a monthly basis from the Federal Egg Bank Reserve. Those are the two tests that I would initially start to offer. But doing tests just randomly to check on things without wanting to do something about those tests is not advisable. But I generically tell any individual I come across, it is valuable to have diet, nutrition, supplements in order. Exercise is valuable, again, if for our mental health as well as our physical health. So those are the parameters I would look for or try to optimize before we start thinking about reproduction.